someone told you bioidentical is natural, so therefore it's safe, or hormones are always dangerous, today we make peace with biology, because bioidentical hormones can be a huge resource or a cosmetic disaster. It all depends on how and what you're using. Hi, I'm Dr. Talia Rossi. I'm a longevity doctor and an aesthetic doctor, and I help every day lots of women to live longer, healthier, and feel better in their body and in their aspect, because what really means is how we live our lives. And we know that if we want to live a better life, we have to take care of our hormones. So let's talk today about bioidentical hormones. Bioidentical means one thing only. The molecule is chemically identical to the hormone produced by the body. Typical examples are 17-beta estradiol and micronized progesterone. But be careful! Bioidentical describes structures, not quality, not dose, nor safety. You can have bioidentical hormones in standardized, regulated medications or in compounded preparations with variable dosing. So there are two different words, approved bioidentical versus compounded bioidentical. This is where online confusion explodes. So approved is regulated formulations, and it means that we know the dosage, we know the quality controls, the efficacy and safety studies. In compounded bioidentical hormone therapy, we use custom-made galenic preparations, often marketed as more natural or safer, but with less evidence and greater variability. So, major scientific societies clearly state they should not be routinely prescribed when approved alternatives exist. What these hormones are actually for? Let's talk about real benefits, the ones that matter for quality of life and longevity. The most cited guidelines remind us that hormone therapy is the most effective treatment for vasomotor symptoms, hot flashes, night sweats. Is useful for genitourinary syndrome of menopause, vaginal, urinary, and sexual symptoms, and can help prevent bone loss and fractures in appropriate context. The risk-benefit profile changes with type and dose, route of administration, duration, and timing of initiation, and whether a progesterone or a progestogen is needed to protect the endometrium. So this is personalized medicine. So what we can say about it and what not to promise. Online, you often see bioidenticals is equal to total anti-aging. No, that's marketing. What is correct to say is estrogens influence tissues like bone and genitourinary system. They can improve sleep and quality of life in many symptomatic women, but the clinical goal is function and well-being, not slowing or stopping time. And above all, therapy must be tailored to individual risk profiles. Important is the route of administration. Why this changes everything? One of the most important factors isn't the word bioidentical, it's how the hormone enters the body. We have the transdermal route. In patch, gel, or spray, avoids first-pass liver metabolism and is often preferred in certain risk profiles. And then we have the oral route, convenient but passes through the liver and alters some markers. And then we have the vaginal or local route. And this is essential for genitourinary symptoms, often with a minimal systemic exposure. And then we have the injectable implants or pellets. This is where caution is critical. Long-lasting can also mean hard to adjust if the dose is excessive. Scientific societies emphasize the importance of type, dose, route, and true personalization. Let's talk about progesterone and endometrial safety, the point that prevents serious problems. If you have a uterus and use systemic estrogens, endometrial protection with a progestogen or progesterone is usually required. This is a cornerstone to reduce the risk of endometrial hyperplasia and cancer. This is where do-yourself approaches and creative dosing become dangerous. One major concern in the literature critical of compounded therapies is dose variability and the risk of underdosing the progestogenic component. Another myth to gently dismantle is this: we do a salivary test and create the perfect dose, while scientific societies point out that routine dosing based on non-standardized tests, often salivary, is not supported by solid evidence and may lead to inappropriate therapy. Real personalization is based on symptoms, medical history, risk factors, goals, clinical response, and sensible monitoring. It's not a hormone tasting menu. And what are the risks and the controversies? Well, discuss them without fear-mongering. Hormones are not candy. Risks depend on context. Guidelines reiterate that risks vary by timing, dose, route, and duration. And then there's the compounded issue. The Endocrine Society and ACOG raise concerns about misleading marketing claims, lack of standardization, variable quality of dosing, absence of robust safety and efficacy data comparable to approved drugs. So this isn't demonization, but it's risk management. So when a compounded option may make sense, well, there are some rare but real cases. There are situations where a galenic preparation may be considered, for example, intolerance to excipients or needs not met by available formulations. But it should be a carefully reasoned exception, not the rule, so does moral superiority. Practical checklist. Are you in good hands or inside a disguised advertisement? Always do full medical history and the risk assessment. Evaluate approved alternatives. Discuss lowest effective dose and reassessment. Receive clear instructions about abnormal bleeding and follow up. And be cautious if you're told they're natural, so 100% safe, or you need them to look younger, or they work the same for everyone, or we'll do salivary tests and let the body speak, or you don't need progesterone, don't worry. Well, if you have a uterus, well, you need it. If you want to learn how to distinguish science from marketing when it comes to hormones, supplements, or just longevity news, subscribe to the channel and hit the bell. Every week, I explain how to build a longevity routine. Skin, hormones, metabolism, nervous system are all integrated. Now, tell me in the comments, what is your biggest fear about hormones? And if you're looking for a personalized longevity and deep well-being pathway, you can contact me privately. We'll build your program together with a strategy that truly makes sense for you. On my website, you can find more content on what I talk about every day, longevity and beauty. See you in the next video.